the Health Secretary has said that COVID could be with us forever and we have to learn to live with it. Sajid Javid compared the coronavirus to the flu during the Downing Street News conference yesterday, saying we won't shut down our entire country and put in place lots of restrictions to deal with it. Well, as those restrictions begin to ease, there are understandably many questions left to be asked about what the coming months are going to look like. Well, here to answer some of the questions that still remain, we have an expert panel this afternoon covering a number of areas that are going to be impacted by these restrictions lifted. We have Oksana, Pyzik, who is lead of the Outbreak educational programme in infectious diseases at University College London. Shaun Simons, founder of Compton Investment Agency. We also have Hannam, head teacher of Lichfield Cathedral School and chair of the Society of Heads and the Futures Group, and Estephanie Dunn, regional director for the Royal College of Nursing in the northwest of England. We have all bases covered here on Sky News this afternoon. Welcome to you all. I'll go to Shaun, who's ready to talk to us. And it's a return to the office today, Shaun, which is good news for your sector as a commercial property agent. Are we seeing a rush back to the office, or do you think it's going to be a gradual return?
Well, I mean, it's not only good for our sector. I think it's good for society and the economy generally. I mean, quite frankly, every city centre relies on office workers. You don't need to kind of rent or sell offices like myself to benefit from it. Everyone will benefit from office workers being back in the office. 2021 was a very, very stop-start year. People, I mean, with the government messaging keep changing, people were threatened to come back, but it kind of never caught the momentum. And last year, obviously, we started to get momentum around October, and then Omicron came and kind of killed all the momentum we had. All I can say is in the first kind of 2 and a bit weeks of this year, we're starting to see demand, dare I say it, get back to kind of where we were pre-COVID. There does seem to be a real appetite from not only business owners, but employees to get back to the office. Funny enough, I think the longer this whole process has gone on, the more it's solidified people's views that they want to be back in an office. And I kind of feel that the novelty that perhaps started in March 2020 has very much now worn off.
Yeah, Shaun, during this pandemic, this is the third call from the government for people to return to the office. Businesses hoping they'll get a longer run at it now. But it's interesting you say about people wanting to get back to the office, because anecdotally, people have been saying, look, the world of work has changed now. People are enjoying working from home. Is that the case, do you think, going forward? Is the world of work changing? Is office space changing as a result?
Without question. And actually, the office and the way the office behaved pre-COVID was changing anyway. I think all that COVID has done is perhaps sped that up a bit. Hybrid working is something that is going to be a mainstay, I believe, in the market. And I think the way occupiers are looking at the way their buildings look and behave is definitely going to change. I've been pretty outspoken since the beginning of this, because when this whole thing started and everyone said it was the death of the office, no one's ever going to work. I never quite believed it. And I think the longer time's gone on, the more that's solidified. You only need to look at kind of recent, some of the largest businesses in the world kind of committing to large swathes of space across the capital and across the UK to kind of justify that. But the answer is yes, it's changing, but it needed to change. But the office will live on, for sure.
Let's bring in Oksana now. Oksana, from a public health point of view, the Health Secretary said the lifting of restrictions is a moment we can all be proud of. Do you share that sentiment? Was it the right thing to do? Because statistics out today, if you look at the figures, 93% of hospital beds are full this week, 77,000 staff were off sick this week, 46% COVID-related. We talk about 100,000 infections plus per week, and 83,000 patients going to hospital via ambulance this week. So when you look at the state of the NHS at the moment, do you think these restrictions are being taken away too soon? Should it be more gradual?
Look, we have more people now, more than double the people in hospital now than when Plan B was first implemented in December. So from a public health point of view, a tapered approach in reducing restrictions in a more tempered way, in a more gradual way, would be safer. However, I do agree that return to work is an important aspect, but then we should also ensure that those workplaces are safe. We need to have government-regulated ventilation standards, as well as if you're encouraging everyone to mingle indoors again, then removing face mask wearing isn't matching up with those calls for people to get back to the office. So from that perspective, I think, the NHS is under continued pressure. However, Sajid Javid's declaration of good news seems to be more of a distraction from Partygate than something that's grounded in data and public health evidence.
Estephanie Dunn, when you look at the data, are you confident that Plan A is the right way forward at this time? I referenced those figures there that you heard.
Absolutely not. We're extremely concerned as a college because our members are telling us about those unsustainable pressures that Oksana has just referred to. The data is telling us that the pressure is there and it's mounting in many parts of the system. We have a situation where we went into this pandemic with 40,000 vacancies for nursing. And here we have, I think as of the 16th of January, 29,500 staff off sick, much of it being COVID related, huge numbers of sickness absence across the system. So we're not seeing this lifting of pressure. We are seeing higher levels of occupancy. We are aware that social care is under even more pressure or a similar pressure around staffing and availability of beds and capacity to discharge patients from hospital who no longer need to be there. So again, I would echo the call for a more cautious approach. We should at least be thinking about, some of those public health measures. And I think Oksana's right, that the public health measures around ventilation, face coverings as people return back to the office, using more public transport, all of those things, pose a big risk for us.
I'm pleased to say Sue Hannam is back with us, head teacher at Lichfield Cathedral School. Sue, we've re-established communications with you. It's good to talk to you. I was just saying that one of the changes that came in immediately was masks in school. So it's a case of here today, literally gone tomorrow. Did you welcome that move, or was it too much too soon, in your opinion? You didn't really have much time to get your head around it.
No, I have to say I absolutely welcome that move, and so did my students, some of whom are behind me working hard now. It's really incredibly difficult to teach wearing a mask. It's very difficult for the children to learn wearing masks. They essentially don't like them. And whilst we completely understand that you've got to balance out the health risks against those learning risks, I think there's also a huge issue around mental health and poor mental health and well-being with young people. And certainly the pandemic has cast a really long shadow with that. The children have, since they've been back in school, absolutely followed rules around, catch it, bin it, kill it, and hands, face, space, and all of those kinds of things can carry on. And I think we can continue, by our own risk assessments in schools to behave with caution and be sensible. And every school and every setting will have its own risks and hotspots to manage. But certainly there was a lot of joy from our children at the thought of not having to wear their masks anymore.
Yeah, I'm sure, Sue, I'm sure. But what about parents? Because that's perhaps the fly in the ointment of the government's plan here, in terms of some schools will have outbreaks of COVID and say, look, we're going to have to go back to mask wearing. A lot of schools, as you said, will be making their own risk assessment. But by the government lifting restrictions so quickly, the school doesn't have any government backup to the decision. And we know what parents can be like at school. I'm one of them. They will be very assertive when it comes to the safety of their children. So the school will have very little pushback. Do you think the government being completely hands-free is a bad idea in that respect?
I think it does make things a little bit more challenging for us. There's no question about that, but in truth, all along, we've had to rely on goodwill. We've had to rely on people doing the testing when they were supposed to be doing the testing. And it wasn't being done in school. So to some extent, the responsibilities around that have stayed with the parents and continue to stay with the parents. I do understand also, the concerns of people, and certainly we've understood that all along. There is no doubt that we will continue to risk assess. And certainly, as you rightly say, last term we had quite a problem at the beginning of term with a lot of staff and a lot of pupils out with COVID. And we've brought in mask wearing before the government said you should. And interestingly, our parents were really supportive of that. It will be very interesting to see how it works in reverse, though.
Sue, while we're on that subject, we've had a viewer message us, Lindsay. She said, I feel very anxious about the thought of self-isolation rules ending. It's possible that that will happen towards the end of March. When I have a vulnerable child who isn't able to have a vaccination yet, he attends a school where the virus loves to spread. How can this be safe? They are the messages that are coming into us at Sky News, and they're the kind of messages you're going to have to deal with a head teacher in the months ahead.
Yeah, and I absolutely understand that. And we have huge sympathy with families that find themselves in that position. And certainly we've also got, pupils in school who've got parents at home who are vulnerable, and they are also really concerned about, have really scared children about their parents. And I think that works in both directions too. I think I would, just refer them back to the fact that schools have been having to manage this risk now for a considerable length of time. We've had to equip ourselves with knowledge and the ability to assess the risk insofar as is possible and to mitigate it. And I have absolutely no doubt that all schools across the country will continue to do everything they can to minimise the risk to the children that come in. But the truth remains that we cannot sanitise the world.
Oksana, the Health Secretary, said we are going to have to learn to live with it. He compared it to flu. It comes to a question that Adrian, a viewer, has put to us. He said it's highly likely that COVID will stay with us like seasonal flu, and will it be a case of annual booster jabs? In your mind, what does learning to live with COVID look like?
Well, that is a popular phrase, and I think sometimes it's used to cover up lack of action. Living with COVID also means that our schools are well ventilated and that we continue to ensure that we have access to things like antiviral drugs for people who are more vulnerable, the elderly, et cetera. And in future, it is likely, because the pharmaceutical companies are already working on this, are tailored vaccines that are more effective than the ones right now that could work against a range of coronavirus variants. Now, that is something that going forward would really help to blunt the impact of winter surges. So hopefully this is going to be the last winter in which more extreme measures would need to be brought in, but it's certainly not going to be the only time that we're going to see cases surge again, even with layers of booster protection, et cetera. However, going forward, we're going to have more availability of antiviral drugs, plus potentially a type of vaccine that's multivalent and is able to recognize, protect against different strains and variants. And that's really something that would be available on a more of an annual basis.
Well, we are expecting to hear in the next few minutes the news on restrictions being lifted in Northern Ireland. Before we get that, I want to squeeze in a couple more questions. I'll come to you, Estephanie. In terms of self-isolation, the Health Secretary has said that that may come to an end when the legislation is up towards the end of March. He said that will be reviewed. But when the Health Secretary also spoke yesterday, he said that testing is key. And you do wonder, what is the point of testing if self-isolation is going to come to an end? Do you think self-isolation should stay as government guidance? Or, as he compared it to flu, it should be, if you've got COVID, just use your common sense and stay off work?
Yeah, or work from home, because not only is he predicting the end of self-isolation, we're removing face masks, we're putting people back into workplaces, back into schools. Some of them are overcrowded, some of them have got ventilation systems that are not necessarily fit for purpose, because not all schools are equal. And in that environment, the risk of spread is enormous. So I think it's really important that they do take a more cautious approach, a more phased approach to this, because we know that the NHS is probably at a breaking point. Our nurses are really struggling, and they see the victims of some of these policies, some of these practices that lead people to be more susceptible and more vulnerable and have to be admitted to hospital. But there's also, and whilst recognising the long-term impact and the mental health impact of the way we have had to live over these last 2 years, we are not really paying sufficient attention to the impacts of long COVID, how it affects people. It's affecting younger people, it's affecting older people, and it's affecting the workforce as well across all parts of the economy. So I do think until we're in a situation where we've got targeted vaccines, we do need to constantly think about, have we got the right protection measures in place? Are we using them properly, appropriately? If we are going to get rid of self-isolation, do we need a rethink around face masks and other things?
Yeah,
so
Stephanie, you raise a really good point there.
Soon.
You raise a really good point there in terms of the next step of what we're going through will be talking about long COVID and its lasting effects and, of course, mental health. They are the next steps that, as a country, we are going to have to go through. Final question to Shaun, because we've been talking about caution here, but people returning to work, put me in the picture about what this is going to do, not just for people working in the office, but local economies. We know the knock-on effect of a thriving office in a community. We're talking dry cleaners, we're talking sandwich shops, you know, we're talking gyms.
I think it's been devastating. I mean, my office is in Farringdon. I've worked around here for 18, 19 years. I've seen lots of people barbers and sandwich shops and convenience stores kind of going out of business because, as I said, you don't need to be an economist to work out that if you don't have workers, office workers working in city centres, then the economics just don't work. So I think this is going to be a game changer, quite frankly. For the last 2 years, it's been a really devastating outlook. And hopefully, providing things are done in a safe and measured way, we can kind of keep this momentum going. But I do anticipate 2022 is going to see a very large return of the workforce back into office space. And
Okay.
I think it's much needed.
OK, interesting to talk. Shaun Simons, Oksana, Pyzik, Sue, Hannam and Estephanie Dunn. Thank you very much. Talking about the easing of those Plan B restrictions, return to Plan A.